us today on this Wellness Wednesday is News Channel 20's expert, Dr. Craig Bax from the Center for Prevention, which aims to cure chronic diseases. Thanks so much for joining us.
Thank you for having me.
And today you want to focus on a chronic disease that is really at the cause of most heart attacks and strokes. Talk to us a little bit about that.
So it's called atherosclerosis. We tend to refer to it as arterial disease. And it is a chronic disease that pre-exists heart attacks and strokes for many years. I think one of the key things that I want our viewers to understand is that this is a progressive condition and that commonly it's managed by dealing with the end stage results. You have a heart attack or if you have symptoms of a stroke and get rushed to the hospital and an intervention takes place, a procedure of some sort. But I think our point is to make the viewers aware that if you know that you have this condition, it's reversible. And even to the point that we would consider it cured because it can be reversed and held in check for an extended period of time. So you don't even have to worry about these events occurring.
So let's talk about that. How can one detect if they have this arterial disease?
So the tool that we use most commonly in our practice is ultrasound. So this happens to be a device that I can carry around in my briefcase or pocket, and it allows us to detect atherosclerosis or arterial disease in the arteries in the neck or even in the legs or the aorta. And if you know that you have it, then you can measure it, treat it, and see the results of your treatment as it improves. The other thing that we use is a body composition analyzer. The body composition analyzer tells us what you're made of, how much of you is muscle, bone, fat in particular. And in particular, there's a concept called visceral fat. It's a fat that's inside around our internal organs. You can't pinch it, you can't measure with the calipers, but this device tells us if you have high levels of visceral fat, and if you have that, you're more likely to become diabetic because visceral fat leads to insulin resistance. Insulin resistance not only causes diabetes, but it's a very common root cause for atherosclerosis, that condition that we just talked about that leads to heart attack and stroke events and either shortens lives or dramatically changes them for the worse by causing disability.
So if someone is interested in doing one of these body composition tests with you to find out if they are at risk for this arterial disease, how should they contact you?
So our number is 217-321-1987, and our website is thecenterforprevention.com/HHS. Will take you to a link that will allow you to give us your information. We'll contact you for an appointment. When we do this, the ultrasound scan and the body composition together, we charge $100 to be screened. That's out of pocket. Insurance doesn't cover for screening tests, but often the findings will then allow us to support doing further testing so that we can understand what's causing this disease in your individual circumstances and actually address those problems proactively and optimally so that we can get the most optimal results. We can reverse arterial disease and make people healthier again and avoid the consequences in the form of life-threatening and disabling events.
Okay, thank you so much, Dr. Bax, for joining us here on News Channel 20 Marketplace.
Thank you.